Okay, everybody, this is part 3 of a series where I'm discussing communicating with gastroenterology about some of the more common and then uncommon issues we have in the connective tissue community. And as a part of that, we've talked about a lot of other specialties as well, because that's what we are. We're not a multi-syndrome community or a multi-condition. We're a multi-specialty community. We're just that special. We need all of them. We need all that education and all that knowledge in one place. So when you're coming into an appointment or interviewing people, now, in my practice, when we're talking and prepping for appointments, I have a pretty good idea of the symptoms. And so one thing you can do is go through ahead of time, just word vomit all your symptoms. And don't try to block, don't try to make it linear in a certain focus. Just go. Have a friend write it down for you, a family member, record it verbally. Word vomit all your symptoms, okay? Because inevitably, when you think you have a track that's clear up here, by the 4th or 5th one, that's going to lead to a little branch that you're going to go into, and then that's going to lead to another little branch that you're going to go into. And yeah, they all are affecting you, and we can trace so many different things back to POTS, back to mast cell issues, back to... They make sense to us. But to someone else who's never been in our bodies or been with our bodies and has about 15 to 20 minutes to figure it out, not going to get there. So one of the things I hear from physicians that is helpful is helping patients figure out how to present their symptoms so that the doctors can work faster and quicker. Now, before you crucify me on the altar of we just deserve better healthcare and they should know, do take a moment, count your symptoms, and recognize that most people don't experience that many symptoms in their entire lifetime. I believe that someday, very soon, we are going to have a lot more specialists in this area because there are a whole bunch of us going for medical degrees and going into this field to try to change it, and that is going to spark changes everywhere. So until then, here's how we can kind of bend the system and use some social and relational pieces to improve the process. Take that word vomit list of symptoms, get them all out, all of your thoughts on each of the pieces, okay? And then think about what specialist you're going to see. Put that at the top. Gastroenterology. Okay. Pick a color. I like green, purple, pink, red. You might need multiple colors for this. But pick a color and go through your symptom list and circle everything that you know is specifically related to the anatomy of the gastrointestinal tract. Okay? The anatomy of it. That is going to get to things like mast cells, but not first. Okay? So you have nausea. Click. You have trouble swallowing. Circle that. Underline it. You get full really quickly. Check. You vomit. Check. You're constipated. Check. It burns when you poop. Check. Underline everything related to the anatomy. Everything else, move over to the side, and that's your level 2. We're probably going to have to look at some mast cell pieces. We might be able to introduce things that are related to vasculature or neurology, but if we dump those first, that GI is sitting there going, I think they're in the wrong doctor's appointment. I don't deal with that. And you're going to be talking out. They don't have time to write it down. It really does get confusing, yeah? No matter how much education they have. So, when you're going into these first appointments, go in armed with a focus, and that's your lead capture. That's how you're going to draw them into the experience of you. You are in charge of this appointment. You are going to interview them and see if they can be a good fit for you, not the other way around. Don't expect them to know everything and what to do and how to treat you as a person. They've never met you before. Yeah? It's an arranged marriage where you have very limited interactions and they have to do big things for you like major surgeries. So go easy, be patient. Sit down with your doctor. You're in the appointment. Yeah, you've got your list in front of you. You've got your pieces and they say, well, what are your symptoms? Done. Start with those very obvious, very straightforward, very GI related symptoms. And then let them ask you questions. This is the trick. You have to let them ask you questions. And you can start to tell from the types of questions that they ask if they are trying to get to know the depth of your condition and the nuances, or if they just think you're making it all up. We want them to explore you, and we want them to explore you on their terms, in a way. Their brain, their process. Arranged marriage. You don't know how they think either, but you can learn it by watching them communicate with you. So you come out with, it's like, okay, nausea and vomiting, I'm struggling to eat. It's just like I'm full all the time, and there's reflux, and that hurts, and I've done all these diet things, I just don't know what's going on. Yeah, act dumb. Don't give your suspicions. Don't say, I think it's this. You need to let them learn you. And as an autistic person, it's very hard to not just tell them what I think it is, because I've spent hours working on it. Let them explore you. Let them ask, okay, when do you feel the pain? Does anything make it better or worse? That's going to be a common question. Another thing you can prep ahead of time with your symptoms. What makes it better? What makes it worse? When does it happen? Yeah. So, okay, what about your nausea? When does that happen? Better? Worse? Discuss the things. As they ask the questions, you may have some room. Like, oh, well, I get nausea after I eat. Also, sometimes when I smell things, I have a lot of allergic reactions to stuff, and I read that we can have mast cell issues, so I'm concerned about that. That's as far as you need to go for the GI, because as I mentioned in segments 1 and a little bit in 2, the GI is going to stain for mastocytosis internally, and we need them to do that. We want them to do that. They can't diagnose mast cell activation syndrome or typically handle the nutrition issues in your body, so you don't need to advocate for that. They can't do it anyway most of the time. And if they can, you don't have to find that out. They're probably publicizing it. They'll tell you, oh yeah, I work with Ehlers-Danlos and mast cell issues are a thing. We've got a nutritionist over here that knows what to do. You can see them later. I'm going to do this. They publicize it because they know that's what's needed. If they're not publicizing it, they're not going to go there. So just add that in. And then when you circle back to your endoscopy or your colonoscopy, you can ask, are you guys going to stain for mast cells just to check? They're like, yes, yeah, we'll do that. Awesome. So as they ask questions, you can take some side tracks into other symptoms. And they're not going to be random. They're not going to be overwhelming to the doctor because they match his or her train of thought. You're matching them. Yeah, and kind of ending up parallel. And then in that process, you can eventually, and in the best appointments by the end of it, you can be a little bit more open about what's going on with you and how. But when you're starting off, you treat it like everything's up in the air. Treat it like you're looking to them for a solution. And that's not pandering to their ego. Some people, yeah, I've met those. I know. What you're doing, like on a date, when you ask questions about someone else, you're trying to communicate who you are at the same time. through the questions. And when someone else is asking you questions, you're considering a deeper relationship in the process. And so how you answer is painting a picture of you. By letting them get to know you in this way, you are opening the door for them to get a better idea of you than you can probably present to yourself in a box. You know, we could put ourselves all in a box and hand it to someone and, oh, whoops, that's the wrong box for you because I didn't know. Yeah, so don't put yourself in a box ahead of time. Let them discover you. Let them find out about you. Warning signs: if they don't want to know anything about you, if they don't pick up on any of the hints you're dropping about other elements of your condition that maybe are relevant to what they do, that you've learned from your research, that you've learned from other patient experiences, if they don't pick up on that, just notice it. Don't waste your energy being mad at them for not noticing. We could still get something out of this. Yeah. And I'm a fan of the plan B and the plan C, especially when it's all this energy and money and hard to get some places. So just notice if they're not picking up what you're laying down, we're probably not going to work as much with them. We're going to find someone else for those more serious issues. But we could still get something out of this. We could still get some key testing done on record for major conditions that need to be ruled out, for very alarming issues that can get calmed down, and kind of confirm, oh yeah, I'm actually an EDSer. We can get mast cell staining done. We can even get all the way to some basic motility testing. And some of these tests are maybe have to be redone in the future or read properly, but in the GI world, it's pretty straight. There's a lot of things that are really straightforward. I'm going to give the benefit of the doubt to everyone except, the worst, the C students, back to education, the C students in college that still became doctors and don't care about their jobs. Yeah, they're probably getting things wrong. Be aware, be knowledgeable, but you can still get something. If we've done our homework and we are at least in a reputable system that does a good job for your typical people, they're probably not going to completely mess up all of your testing. And you've got a foundation, and you're getting some key things ruled out and some key doors, groundwork laid. Yeah, if anything, peace of mind. Worst case scenario, they just don't like you, and this whole process of carefully presenting primary symptoms and allowing them to explore you and get to know you, you get home, you look at the notes, and they're terrible. They're like, patient needs to go see a psychologist because it seems like their pain is related to this trauma that they mentioned. Never mention trauma on a first date. Same thing goes with doctors. I would, as a trauma survivor, it is not something I bring up on the first date with a doctor. I wait until the third or fourth date because it biases them. Go check your notes afterwards. Did they hear you? Did they track with what you were saying and some of the key pieces? They're probably not going to have caught everything. Okay, so if they got 70, 80% of what you were putting down, that's awesome. Go for another date. Continue the relationship. Build. See if they'll continue and build with you. Get to know you. There are some truly great people out there who will take the time to go and research crazy stuff because they care about that individual and they've gotten to know you and they've connected with you and they care. It does happen. And that is a golden moment, especially as an advocate when we're in a barren desert and I can get a patient to someone. We do an approach, we build the relationship, and this doctor has never done X, Y, or Z before, but for my client, they are laying it out. They're trying different testing, they're trying creative options, and even if none of them come back helpful, I'm cheering and we're happy because they paid attention. There are people out there that do that, that could take care of you. Yeah, second, third date. It takes a little bit of time. So I hope this is helpful for some of you trying to seek care and diagnoses, and a lot of the same processes are true for any specialist you're going to see. Again, there's so many unique and individual experiences. This is certainly not representative. It's not the one guaranteed method that's going to work for everybody. I've sat with those doctors, and like I've said in some of the other clips, it does not matter what you say. They're not going to help you. And I'll close with this. Sometimes we really do need psychology, and we do need psychiatry. No, it's not all in our heads. But there is a very close connection between mind and body. We know that better than anyone. And caring for your mental health, caring for your emotions, finding that person to help, and preparing that background and that history can be really key. This neurologist who put all these things in my notes, well, he didn't know that I not only have a fabulous therapist, but I'm friends with an autistic neuropsychologist, friend, colleague, distance, we know each other, who had absolutely no problem, knew me, ran, analysis. My patient is not psychosomatic. This is wrong. This neurologist had no idea because he never took time to get to know me and my diagnoses and the whole picture. I was insulted. I imagine my doctors, they were insulted by this guy's arrogance and assuming that their diagnoses were incorrect. So there are some great resources in our community. There is Chronic Hope Counseling out in Raleigh. People that can get to know us and go deeper. There's a couple of really great psychologists in our community, psychiatrists that we can work with. It is not always a bad idea to get some intervention help for anxiety. POTS conditions, MALS, these things affect us, and it's hard to manage all these appointments when our bodies are angry at us all the time. And so I'm a huge fan of natural things. I've mostly done natural myself and not gone the medication route. I'm just very, very sensitive to those things. But I support the people that do. And often they don't need it for a long time, but it helped us get through what it means to manage this condition. So I actually deeply appreciate a doctor that understands that there's a mind-body connection to these issues. And I've been there when they cross that line in the wrong direction. So hopefully a balanced perspective for you. Thank you for watching this series on gastroenterology, and I hope you are all having a wonderful new year. Bye.